Dana, I'm so excited to have you here today and talk about all the things from being a doctor, founding Yoxley, building a company, breaking down taboos of sexual health, and so many more things. So maybe let's start from the beginning and tell us your origin story. Where did it all start?
Oh, fantastic. Well, thanks for having me. I'm also super excited to be here. So, I suppose you can tell by my accent, I'm not from the UK. I grew up in the US, which is where I did my undergraduate and graduate education. So, my parents are ethnically Greek, but I was born and raised in the States, in New Jersey. And then I studied in Boston, Philadelphia, Chicago. I also did a brief 2 year stint in Cyprus, which is
How
really
exotic.
I know. I'd never been, but I'm a Greek speaker. And so they had opened their first medical school there, and they were delivering a UK medical course in different countries around the world. And so I thought, well, this is an interesting experience, and wanting to, I suppose I'd been in Philadelphia for 4 years, so wanting to kind of, I suppose, switch up the scene and try something new. I moved out to Cyprus for 2 years, and then I came back to Chicago to finish my medical degree. So it's been a whirlwind. I can say I've always wanted to be a doctor. So,
Are your parents doctors, maybe?
no, neither. They were very disappointed. They were like, "Are you sure this is what you want to do? Is there like nothing else you want to do?" They both work for the government, so
Okay.
probably as far away from being a medical doctor as you can imagine. But I was the doctor in my pre-K, like pre-kindergarten play, and I was like, "This is it. I found my
This
calling."
is it. I found my calling from age
Yeah,
of 4.
yeah, 3.5, I believe.
Love it.
I know, I
When you
know.
know it, you know it, right?
Exactly. When you know, you know. And so I never really thought that I would be an entrepreneur. I was always like, I'm going to be a medical doctor. This is my path in life. And I suppose it came as a shock to me as well when I kind of, I don't want to say sidestep, but when I kind of broadened my horizons and I realized that like you can use your medical degree in different ways and not just in the way that is kind of prescribed, no pun intended, for healthcare professionals. And so, so I did my undergraduate, graduate, and med school education, and then I came to Oxford in 2015. My plan was not to stay. They had, obviously, the university is really good, and they had some really interesting research, and so I wanted to see what it was like to live and work in a government run healthcare system, because that's really exotic to us in America.
Of course. There's this saying, we in Europe, healthcare is a human right. In the US, it's a business.
It is 100% a business, yeah. And I think like there has to be a happy medium. So I think healthcare has gotten so big, and there is the consumerization of healthcare, right? So like it has to be a balance between like a charity and a human right and actually functioning as an organization. So I came to Oxford, and it was a little bit of a culture shock. It was not like Chicago, but I met some really amazing people, and I learned loads, not just about healthcare, but also about the system and the way that it was being practiced. I became involved in my first medtech startup, which was really interesting. And even though it wasn't the right startup for me long term, I took a lot of the things that I'd learned and I applied them later to Yoxley.
Wonderful. And so from medicine, there's something about so many people I know who either did medicine, I mean, myself, I did neuroscience and then went into the world of business. And I think for a lot of people from the outside, it feels like such a eclectic jump, but actually there's definitely some parallels, I think, from the world of natural sciences to like the business that are somewhat unexpected but really transferable when it comes to entrepreneurship in particular.
100%. I mean, if you think about it, like a business and a body, like they're just living organisms, right? They need to be able to function. And so you have to be able to look at the different organ systems like independently and then see how they function together to create something that works overall.
And how did you? So let's talk about Yoxley,
Oh
right?
gosh, yeah.
So how do you go about from sort of being, studying, like preparing for your medical exams, being a doctor, etc., to, what? I'm gonna take a plunge. I'm gonna make the jump into this crazy world of startups.
So it was really interesting. So I have a background in public health. So before I went to med school, I got a couple of master's degrees because I love education. And it wasn't until I hit 30, my father's like, please go get a job. You're educated. Like you
It's
stayed in
time.
school. Yeah, long enough. Like go to the workforce. So I have a background in public health, and everywhere, I suppose the idea for Yoxley had been percolating in my brain for over a decade. So everywhere I went, whether it was different parts of the Americas or Africa or Europe, I saw that sexual health care was really fragmented. And it was in Philadelphia that I was writing my first thesis on the health disparities and resiliencies that existed within their transgender community. And I was like, here's a group of people who's really good at having open conversations about their sexual health needs, because oftentimes their needs weren't being met by conventional medical practice, right? Like they were educating their providers. And I was like, everybody should be having these conversations. But unfortunately, because the subject of sexual health is still entrenched in stigma and shame, which is entirely outdated, but it's the reality, you know, even providers were sometimes reluctant to broach the subject. And so, anyway, so I kind of took a mental note. A few years later, I was living and working in Oxford, and I saw that, you know, with the even in a place where healthcare was technically free at the point of access, people were still, with my previous startup, asking for private sexual health services. And I was like, well, this is really interesting. Yeah. I was like, why aren't they accessing the services that are supposed to be readily available? Like, what is it that's preventing them? What are some of the barriers? And then I suppose I was at that time also working in the emergency department, and I was seeing loads of patients come through with late-stage complications of undiagnosed and untreated STIs. So I thought to myself, well, this is a lose-lose situation, because the healthcare system ended up paying hundreds of thousands of pounds to manage these late-stage complications, and then the individual, for their quality of life is suffering. So I was like, nobody's benefiting from this. So I became, I suppose, very frustrated. And I was this like angry little doctor stomping around asking, why doesn't anything work? And so instead of, I suppose, being frustrated, I decided to try and channel that, that energy into something more productive, and came up with Yoxley as a solution. And I did that with my current co-founders, who happen to also be my neighbors and my friends.
Oh, I love that story so much. It's like, real entrepreneurship spirit over there. Like, how many of us know the names of our neighbors? It's like, talk about networking.
I know. Well, we were neighbors and friends. So I met one of my co-founders, Judson, because his dishwasher leaked into my apartment. So he lived in the...
So resourceful. Like, I'm going to help you, my friend.
I know. Well, we were friends. I mean, we were neighbors and friends long before we were co-founders. And then our other co-founder, Jason, just lived down the hall from Judson. So we all just lived in the same block of flats. And then after many dinners and years of kind of being friends, I kind of discussed this problem that I saw with them. And they had very different skill sets to me, but they were really complementary. And so the three of us kind of put our heads together, and Yoxley was born.
Super. I think when we think about sexual health, right? Like, to me, it's a little bit where mental health was like 5-10 years ago, where, at the time it was sort of like uncomfortable to talk about the fact that, you might be seeing a therapist or going through CBT or whatever, right? But now it's almost the other way around. The pendulum has shifted, and it's now almost trendy and cool to be like, oh, I'm going to see my therapist.
I know. I was like, who's
And I feel like sexual health is like the next big social taboo to be breaking down, right? Because when you look at, and it's not just developing world, by the way. Like, if you look at syphilis cases, it's like the highest since World War II or something, right?
Yeah.
And yet nobody's talking about it.
No, exactly. I know. Like, and not only that, but like congenital syphilis is on the rise. Like, some of the STI rates are spiking all over the world. And exactly, it's a mistake to think it's just in developing nations that don't have access to testing. It's all over the world. Like, I think it's 20% of people in the US have an STI on any given date. And that was an estimate by the CDC. And you're right, in the UK, some STI rates are the highest they've ever been since recorded record. So we need to do better. But I think the challenge is when we only focus or we only think about sexual health as the absence of a disease, like, I think we miss certain psychological and social factors that drive behavior and serve as important determinants of sexual health. So by ignoring those things, we're never really going to tackle the problem of STIs, which in my opinion is just the tip of the iceberg.
And I think what's wonderful about the power of social platforms, right, is that some of these conversations is something that maybe a lot of people don't even feel comfortable talking to their doctor about, right? Because there's a sort of this stigma, shame, as you say, the social taboo. But at the same time, I mean, you guys have 1 million followers or something, so people are clearly interested and they want to know what's going on with their sexual health, right?
100%. So yeah, so social media has been incredible. And that's the one thing that kind of really prompted me to step out of day-to-day medical practice and actually focus full-time on Yoxley. I realized that I could work every day for the rest of my life in the hospital, and I would never reach as many patients or people as I did using social media. And we did that over the course of 7 months just by creating educational and relatable content. And yes, there is a demand for, information about STIs and kind of like the physical aspects of sexual health, but it also reaffirmed our assumption that, sexual health is more than just the absence of a disease, that people have anxieties and insecurities and concerns. And you're right, they don't go to their doctor. One, because they don't feel it's a good use of the doctor's time, or two, they're too embarrassed to bring it up. And as somebody who's worked in an emergency department, I've begged people, who've come in with either a sexual problem or a sexual related injury. I honestly don't mind. Like, there's no judgment on my end, but I really need to know for the safety of your care. And there is still in that formal setting a certain amount of resistance or reluctance, to be completely open about what's happened. But through social media, people feel a degree of anonymity, but they don't have to feel alone. So what we do on social is we try and create educational content, but we also want to dispel a lot of the misinformation and disinformation that exists on social, because we know that it's an incredible tool and I believe it can be harnessed for good. It's just about reaching people in the right way.
And I think that's the power of, your medical background, right? That you actually can have this tone of voice that is not just, it's not just some kind of like random facts and myths that people play with, but it's a medical, there's medical content out there that is trusted, reliable. And so people can, of course, fun and engaging, but at the same time, like delivering, real medical help that a lot of these conditions need. Right?
Yeah, they definitely do. No, definitely. And I think it's sometimes there was a struggle in the beginning because you can't say all the things you want to say in a 30-second TikTok. And you don't get to have that back and forth dialogue that you can with somebody in person. So if they have follow-up questions, you don't have an opportunity to clarify. So I think it is stressful and probably scary for providers to get in front of the camera and to actually be trying to create this type of content for people.
But not for Danae. Danae's rocking it.
I was terrified in the beginning, and it's a learning process, and I've had some help along the way, which has been really fantastic.
And so you're a female founder talking about building a project, a startup in a sexual health space. I mean, there must be some fun stories you were fundraising with ECs.
Yeah. So I'm trying to narrow it down. I think the subject just still makes a lot of people uncomfortable.
What? We're going to talk about sex?
Yeah. I know. We're going to talk about sex. And so when you open your pitches, let's talk about chlamydia. You could just see investors lean back and cross their legs and just look away from the camera. And you're like, oh, have I lost them? So my dream is to, get beyond that. Oh, you're that chlamydia girl. And you're just like, oh, that's...
I mean, at least, brand recall.
Yeah, I was like, sure, yeah, okay, we can start there. But yeah, it's not a subject that everybody feels comfortable talking about, but also not a subject everybody knows about, even though sexual health is a universal human need, right? It's a need most of us have from the time we're young adults to the time, if we're lucky, we die. And yet there's this reluctance to have that conversation. And I think if we can start to break down that barrier, just to even acknowledging that the problem exists, I think we can do some good. But yes, not all investors. It's not I suppose it wasn't something that all investors kind of had on their portfolio checklist.
And I wonder, being a female founder, right? We just, it's so widely spoken. We just need to look at the statistics basically. And it's so few women that decide to either choose this path of entrepreneurship or actually, manage to raise funding. And it's a very multifaceted issue in many ways, both top of the funnel, but also with potential biases when it comes to, the fundraising process. Is there anything you've experienced personally that speaks to that?
Yeah, let me think. I think being a female founder is automatically a bit more challenging. And I think that's true in certain professions in general. I think especially professions that tend to be male dominated. And there is this kind of gradual movement towards, more inclusivity. But I think you come into the room and you have to be, I don't want to say twice as loud, but you have to prove twice as much to get half as far. And I think slowly things are changing, but there is a noted difference, I suppose. And all we have to do, like you said, is look at the numbers in terms of which founders are getting funded. I think the other thing is probably, like we mentioned before, Yoxley is a pretty niche subject. So if I had kind of a blanket, I guess, AI-driven B2B platform.
Gen AI meets
Yeah.
Web3. I'm not anymore. That's like not hot anymore.
I know, yeah, that's true. I mean, the tides have changed already, but like, yeah, I think so. I think put those two things together, like a bit of an awkward subject and, a female founder. I think those two things probably made it challenging.
Do you think having female investors does that help?
I think there are certain female investors who have been absolutely phenomenal, and we wouldn't be here today without them. I also am, I don't want to say wary, but I no longer believe we want to help women, we support women. I think anybody who leads with that automatically in the call, I think now my spidey senses kind of start to tingle and I say, what is it that you're trying to get me to not see? What is it? So I suppose we've had some fantastic female, I guess, VCs and entrepreneurs who have been so wonderful, and I'm so grateful to have met them as part of this process. And then we've met some others who say that they're very pro-woman and they're very, they want to support us moving forward, but actually how do I put this politely? They probably didn't have the best of intentions, or they weren't they didn't disclose perhaps some conflicts of interest that they probably should have. And so my experiences have been really mixed. And so I no longer look at the gender or the gender identity of the investor. I really do try and focus in on the person and what value they can add to the company and to me as a founder and to the team. But I am wary of anybody who, comes out of the gate saying, we support female founders, we are female first, because it's been my experience that often, at least in certain circumstances, those have been the people who probably, would have been the calls that I wouldn't have taken if I knew now what I knew, or if I knew then what I knew now.
And I think it's a sad side of the sort of female empowerment, right? That the taboo in itself that often we don't want to talk about, which is women not helping other women, right? And in fact, sometimes women making it more difficult for other women. Women beware women, right? And I think someone said this, there's a special place in hell for women that don't help other women, because they should know how it feels like. But maybe that's exactly the reason, I suffered, you're gonna suffer too.
Yeah, I think that's a part of it. And I think, and this is gonna, maybe I'm getting ahead of myself here, but maybe they're also threatened. And to those women, they should be. I mean, if we as such a small startup pose such a threat, and, that you wanted to kind of insert yourself, or that you wanted to kind of have like an information kind of gathering kind of call without actually being maybe fully disclosing conflicts of interest, then it says something about them. And I think what's scary for all founders is that, especially when you're getting started, you've got this idea, it's your baby, right? Like it's nascent. Maybe you don't have a huge reputation in front of you. Maybe you don't have all the connections. You don't have all the money. You're going to these people wanting to be open because you want them to get on board with you, your idea. So you need to be transparent. And at the same time, you need to be somewhat, and I've learned this from experience, I learned it the hard way, you need to also be somewhat guarded. And you need to be careful with what information you share, at what stage, and with whom. And I don't know if that gets talked about enough.
I mean, it's a power imbalance that is somewhat inherent in the relationship, at least to begin with, right? And I think I always tell my founders, like, don't give away your power, right? Like, claim your power, and remember that it's a two-way conversation, right? At the end of the day, sure, you want to raise funding, but you know what? Investors, our job is to invest in good companies. So we need you just as much as you need us, right? And I think having that kind of mindset, I think, can help and navigate some of these boundaries, right? And set the sort of the expectations on both sides, so that it doesn't feel like this is some kind of, like being taken advantage of situation. And I think, but it's easy for me to say, but I know it's so much harder to do it when you're sitting on that other side and having to go through it.
I think you said the right word, which is boundaries. I think any investor who is really interested in investing in you as a company, they will come back for that second conversation. And it's okay to say, you know what, I'd be happy to disclose that information, but why don't we go ahead and wait until, our second or third conversation, until we see where this is going to go. And it's also okay to ask about conflict of interest directly. Like, if you're worried about it entering a meeting, just open that meeting with, can I just ask? I don't think there's anything wrong with that, but I think you're right. Like, there is a power imbalance, and, it is the founder, and particularly, if you're the CEO and you're responsible for fundraising, you want to be open. You want them to understand you and your vision and fall in love with your company and get on board with the mission. And at the same time, you want to protect kind of this idea, like what you're trying to build. And when you're in a room with people who have more money and more connections and a bigger reputation, that can be a precarious place. So this is not to scare anybody. This is also not to paint a terribly negative picture. This is just, there are some amazing female funders and founders out there who have changed our lives and the trajectory of our business, and we will always be grateful to them. But this is just also a message to other female founders to say, it's okay to push back. It's okay to wait to divulge certain information. Any investor worth their salt who is interested in actually investing in you, they will come back for that information later. They will respect you for challenging.
And I think something, as women is something, it definitely rings true, I think, to everybody, but in particular, for us, I think being able to reclaim that power, and we've always had the voice, but society has conditioned us to, it's punished us for speaking out. And so I think finding that, that energy and that whatever frustration, anger, whatever emotion that is, but having that strength to be able to, have difficult conversations and establish your boundaries and speak out. It's easy for people to say, oh, just, you should be empowered. It's like, well, I shouldn't be anything, right? And so I think just that's such a beautiful message that I think we as women in particular just often have to learn the hard way, right? And I guess but at least we learned. So
yeah.
Things are getting better.
Yeah, exactly. Things are getting better. And I think you're right. We are taught to be liked before we're taught to be, or at least that was my experience. I can't say for all women, but it's more important that you're liked than it is that you are smart, that you're beautiful, there are all these other things. First, people have to like you to be able to work with you. And while that's true, and overall, it's good to have good relationships with other people, it's good to listen, all of these are important skills, but there are men in the same position who, if they are difficult or if they are hard about things, it's just, oh, they're a go-getter, oh, it's okay, they're just driven, oh, it's just their style, and they're applauded for that.
Totally. And there's actually, I was reading this study the other day from Stanford University, done 7 or 8 years ago, so quite some time ago, actually on a sample of VC investors, because early stage VC investors in particular, because probably it's quite an opaque, lack of data, quite a subjective field where biases can really come across. And so basically there were two groups of students given notes from the IC meeting that investors had. First, double-blinded, so without the acknowledgement, the gender of the investor, exactly same script. And then the second time around, one being labeled being a female investor and the other being labeled a male investor. And guess what? The more confident, the more the woman was, the more aggressive she was being ranked. Yeah. Whereas for men, the more confident he was, the more assertive, the more ambitious, the more, and it's these things that are literally happening in front of our eyes, but so often we just, we don't want to see it. Or, oh, she's just a little aggressive. Oh, she's just a little, and it's well, because we have to trade being liked for being respected, right? Yeah. And that's almost a double-edged sword where how do you win?
Yeah, exactly. How do you win? There are different strategies we employ to get people round to our way of thinking. And sometimes, I find myself spending more time gaining concordance with people and trying to get them to understand that maybe I would have needed to do if I was, a man. And also I'm American, so I tend to be a bit more blunt anyway. So that's something, that's something I've learned to soften over the years, as delivery. Because it's just a really different style in the US versus the UK in terms of how we directly approach an issue or a problem. But I think all in all, women do face a number of challenges when it comes to whether it's on the VC side and climbing that ladder, whether it's on the founder side and it's actually recruiting and getting investment. But I think things are changing for the better. And I suppose it's important to say that not all women will get along just because they are women, and that is okay. But I think if we are able to help one another, and I found other female founders that I really believe in, and those friendships have actually really bolstered me during times when like I was like, oh, this is so difficult, or oh, I don't know if I'm gonna be able to do this. Like actually those relationships with other founders were a huge source of strength and support. So like if you do connect with other founders or, certain VCs, like draw upon those relationships and that strength because, it's I think in particular when they can understand where you're coming from and how difficult it's been, they've gone through some of those challenges themselves. It can be really liberating and it can be so rewarding.
I mean, it's a power of communities, right? And I think for women in particular, like there's a beautiful quote: "Alone, a woman has power. Collectively, we have impact."
I like
And
that.
I think putting that perspective that, it's not just about us as individuals, actually something that, we're helping the future daughters of ours, to make a world a slightly better place, just like our mothers and grandmothers did for us, right? Not that long ago, like women literally, couldn't vote or open a bank account.
Yeah, like actually, I know. So like huge strides have been made. Like it's not to say that things aren't changing, but like there's always a way that we can help. And so like for to those female founders, if you are in a position or VCs, if you are in a position to help and somebody genuinely resonates with you, I'm not asking you to help every woman just because they're a woman, but like if there's a genuine connection and you believe in what they're doing, like open yourself up to that relationship.
Beautiful. I want to ask you a fun question,
Yeah.
to change up the gears a little bit. When things get tough, when building a startup, I mean, it's just such a long, difficult, tough journey where you have to constantly fight for survival, right? The constant ups and downs, a roller coaster. When things get tough, how do you motivate yourself? How do you pick up, get up, and fight to, live to fight another day? What makes you feel alive?
Gosh, oh, that's a good one. I think for me, I draw a huge amount of strength from my team. Like, I think, working with them and seeing all of the amazing things that they've accomplished and that they are choosing to work with us, like, I really do believe in us as a unit. And so, even though I might be having an off day, like, they're always there to say, I'm sure it's going to be fine. Don't worry. Like, we are each other's support system to a certain extent. And obviously, like, that is most true with my co founders who have been up and down this roller coaster with me every step of the way. And I think, yeah, I'm not sure I'd still be on the roller coaster without them, but I'm certainly glad that they're along for the ride.
Love it.
Yeah.
Thank you so much, Danae. This was so awesome. And
Thank you.
go Yoxley.
Woo, go Yoxley. Thank you, Lena. It was an absolute pleasure.